Jeez. Hi everyone, welcome to my live. This is my first live. I've not done a live before, but I thought it would be important today to just come up on here and try to really connect with my subscribers and get to know you and let you to get to know me as well. So if you're joining me live, thank you very much for joining me. Please say hello in the chat. I just want to know where you're joining me from. And again, what's your name, where you're watching me from. If you're subscribed to my channel, thank you so much. And please let yourself know, leave me a message. If you're watching me later on replay as well, thank you very much for joining my chat. So today I want to talk about how a dental hygienist or how much a dental hygienist here in the UK gets paid. So I live in England, in the south of England, in the United Kingdom, and I'm a qualified dental hygienist and a dental therapist. So I'll be touching on the pay of what a dental hygienist gets paid, because that's what I'm familiar with. I'm a dental hygienist. I've been a dental hygienist since 2008. So I've worked as a newly qualified dental hygienist, and now I've got quite a lot of experience, and I'm now working as an experienced dental hygienist. But initially, I did start as well as everyone else as a newly qualified dental hygienist. So today's live is to talk about the pay of a dental hygienist here in the UK. So thank you very much. Welcome to my channel. Welcome to my live. Like I said, my name is Blandina. So let's get into it. So a dental hygienist here in the UK can be paid either as a under the private sector, or you can be paid as well under the public sector. So you can either be public sector paid or private sector paid. If you work privately, usually when you work privately, we're talking about a normal family run dental practice, or a big corporate as well is also private, or we're talking about public sector, which is the National Health Service, NHS, or other public sector such as the military does employ hygienists. The military, the prison services as well employs hygienists. And sometimes you see community hospitals that come under the NHS. Again, those are all private public sector. So please guys, please like my videos, please subscribe. Just let me know that there's people out there interested in my channel. And the more you subscribe, the more you like, the better for my little channel, the better for people who are looking for this content. The YouTube algorithm will push it further to people like that, people like yourselves who have probably joined my live today, but generally because of that, because the algorithm has pushed it to you. And there's some people maybe wanting to learn about dental hygiene, but they've not found the right information. So it'd be quite nice if you can, please subscribe and like my live. All right, so we're touching on NHS pay. We're touching on the public sector pay, which is the public sector NHS. We're talking about private pay. We're talking about self-employed dental hygienists and employed dental hygienists. So these are the different ways the dental hygienist can be paid. You can be paid as self-employed or employed under a company, or you can be privately employed or under a public sector. So pay in the UK varies. It varies in the sense that the pay will vary in the sense of experience. How experienced are you? Are you a newly qualified dental hygienist? Are you an experienced hygienist? Or what level are you joining in? So that mainly will vary as well in the sense of an hourly rate. Are you getting paid on an hourly rate? Are you getting paid a daily rate? Are you getting paid as self-employed or unemployed dental hygienist, that as well will affect how much you're getting paid here in the UK. So again, if you're on the live, please say hello. Tell us where you're joining from. That would be really nice to know who's watching, and I'll be checking my chat. Like I said, this is my very first live, but I think depending on how this one goes, I will be happy to do more lives in the future. So let's have a little look. Let's see my notes that I wrote down. So we're going to start with newly qualified dental hygienist. So when you're newly qualified, obviously you don't have as much experience as someone who's been working maybe for 2 3 years, 10 years, 20 years. Like I've said, I've been working since 2008. So when you're newly qualified, again, you're paid as someone who's stepping into a role. As with any other career, your pay is starting usually on the lower rate. So if you're working on a daily rate as a newly qualified hygienist, it can be anything from, say, £25 an hour to maybe £32 an hour as a newly qualified hygienist. I've known in some cases to be as low as £15 an hour, which again, as a dental hygienist, is not very common. And I personally wouldn't recommend taking a job at £15 an hour as a dental hygienist. But again, it depends with everyone's circumstances. If you feel you value getting experience more than the pay you're getting, then sometimes people can want to take that job just so they can get the experience. And that once they get a year's experience, then maybe they can leave, find another job. At least they can put down on their CV they've worked as a dental hygienist for a year. So, but usually it starts maybe from £25 an hour or £30 an hour, all the way up to £32 an hour as your starting salary. Now, when I started, like I said, I started as a dental hygienist in 2008. But my normal pay then, an hourly rate, was about £28, was £29 an hour. When I started an hourly rate, before then I was employed, so it was different. I was working for the public sector. As I've qualified in 2008. For 2 years, I worked under the public sector, and then I left the public sector. I went into the private sector. So my starting salary then was £29 an hour. And in my interviews, I discussed with my employer that when am I going to get my pay rise? Is the £29 an hour my starting salary? Those lots of things that we discussed. So they did say, yes, we're going to review you in 6 months' time. We will review and see where you are. Then, yes, in 6 months' time, they did review my pay, and I was then put on £30 an hour. So my starting salary in the private sector was it was £29 an hour to start with. And then straight away the same year, in 6 months, it went up to £30 an hour. So like I said, it's different for everyone. I've known some hygienists start straight away at £32 an hour. Some hygienists have started at £28 an hour, £25 an hour, but that's more on the lower rate as a newly qualified or maybe a year experience into dental hygiene. Now, usually the salary could be anything again from a year, maybe £35,000 to £42,000 a year on the lower rate. As you start to gain experience with experienced hygienists, they can get paid anything from £40 an hour, £50 an hour, all the way £60, £70 an hour, £80 an hour, even more. I know hygienists who've gotten paid £100 an hour. So it just varies. There's no set price or there's no set pay for dental hygienists. It just depends with your experience, with your location, with your area where you are. Is it an affluent area or is it a lower socioeconomic area? Is there lower pay there? Again, it depends which city you're in. If it's a big city, again, you might get paid more than in a smaller town or in the rural areas. In a small village, they might pay you a bit less, but in bigger cities, in London, in the south of England, they pay more. Again, in the big cities, maybe in the north. I'm not sure because I live down south. But as you see the statistics, down south England, further south you go, the more pay that you can get. But it doesn't mean that you can't find a good job or high pay somewhere else. But statistically, further south near London, the pay is higher. So as the more experienced you are, the more pay that you will get from, like we said, anything from £40 an hour to £100, even more, depending on your employer. So this is private sector. At the moment, I'm touching on the private sector. So we're really touching on the private sector. That's the pay that you can get, even more. Now, if you factor in the amount of days that you can work, so imagine you're getting paid an hourly rate and you're working from, say, from 9 or say from 8:30 to 5, and you're getting paid every hour that amount of pay, and you're working, say, 5 days a week. And some people work, say, maybe even 2 Saturdays a month, because some patients are working. They don't want to come to a dental hygienist during the week. They want to come during the weekend. So they want to come on a Saturday. So most practices are really encouraging their hygienists to work on Saturdays as well. So if you're someone who's willing to work on a Saturday, again, you can work maybe 2 Saturdays a week, depending on how you feel. Like in my earlier years, I used to work every other Saturday. So I would do 2 Saturdays a month. So sorry, I meant a month. So you can do 2 Saturdays a month. So I used to work when I qualified in 2011. I didn't work Saturdays. I was actually only working 2 days a week. Then I increased to 3 days a week for a long time. And then I increased to 4 days a week. And from 2014, I actually started doing a Saturday as well. So on top of my 3 days a week, I think I used to do 3 days a week, and I would do 2 Saturdays a month. So again, it depends what you want to do. Are you wanting to work on a Saturday? So you can see the pattern. So you can't really, it's very difficult to say how much a dental hygienist gets paid, because it depends on how much are you getting paid on an hourly rate. How many days are you working a week? Are you working 5 days a week, Monday to Friday, or are you working 2 days a week, 3 days a week? On top of that, are you working on the weekend? So all this combined together will determine how much money you're making. I could make a different annual salary compared to my colleague, because it depends. Am I working Saturdays? Maybe they are. Or how long are they working? I basically now work up until 4:30 to 5. My last patient around 4:35. So I do a full day of 9 to 5, but I don't do weekends. So some of my colleagues work on weekends. So obviously they're earning on the weekend as well. So it's a personal choice. It depends how many hours, how many days you want to work. Again, another contribution would depend on how busy is a practice, because you could want to work 5 days a week, but do you have enough patients in that practice for you to work 5 days a week? Because remember, if you're working according to patients, if there's no patients, then you're not earning. There's no one you're seeing, depending on your contract as well. So if the practice is not busy enough, they might not want a hygienist working 5 days a week. They might say to you, they want someone working 2 days a week or 3 days a week, according to their patient base for dental hygiene. So what a lot of hygienists do, they'll find a job that they can work 2 days at one practice, one day at a different practice, another 2 days at another practice, and by the end of the week, they're working certain days where they want to fulfill maybe a 4-day week or 5-day week. They could do 3 days at one practice, 2 days at the other practice. So it all depends how you divide your diary or how busy your practice is, and then you can look for another practice so that you can have the 5 days. If it's a busy practice, like where I work, it's very busy. I'm there 4 days a week, and I'm almost fully booked every day. So it depends where you are. If you feel like you're not busy enough, you want to add another day, you could go and find somewhere else to work. It all depends generally. That's why this career, I love being a dental hygienist. I love the dentistry field. especially as a mom, maybe you have children and things like that, you can actually, the work-life balance is really good. You can choose how many days you want to work, or you can look for a job that really suits your lifestyle. So it works really well that way. So we touched on the salary um, of a newly qualified dental hygienist and an experienced dental hygienist. I want to make sure I don't leave anything out. So I'm looking at my notes, making sure everything is there. So we're going to touch on the NHS. Let's start with the NHS. Now, the NHS basically just means the National Health Service. So if you're working for the NHS, it means you're working for the public sector, you're working for the government, and you're working in an NHS practice. Most of them are maybe in a hospital, big practices in hospitals, or specific NHS practice, dental practice, and you're paid as an NHS or under an NHS contract, but you've got to have a contract with the practice under an NHS banding as a contract. With the NHS, the pay is usually lower than the private sector. So you can start for a newly qualified NHS dental hygienist. You can start from anywhere, let's say from 24,000, 28,000, or 30,000 pound a year. That is your annual salary under the NHS as a newly qualified dental hygienist. So you can start from anywhere from 25, 31,000 pound to 38,000 pound a year. So 31, 38,000 pound a year, or 24, 28 to 31,000 pound a year to 38,000 pound a year. So it just depends which practice, what role you're in. If you're a dental hygienist or a combined dental hygienist, dental therapist, then you might get a bit more pay with the NHS. And the NHS pay is according to bandings, band 5 to band 7, under the what they call the agenda for change. So that determines the pay on the NHS banding. Again, for an experienced dental hygienist or therapist within the NHS, you can get paid anything, again, from maybe £40,000, £40,000, £53,000 a year under the NHS. Now, this depends as well as a newly qualified dental hygienist, dental therapist, all the way to an experienced dental hygienist coming up to 53,000. I've seen some pay go up to 56,000 under band 7 under the NHS. And this also might be a role as an educational role. So if you're a tutor, if you're into a teaching role, again, your pay is a bit more with the NHS. So this is your NHS pay. So let's talk about the advantages. What are the advantages of working in the NHS? So this is comparing working under the NHS and working under the private sector. So the benefits for the NHS mainly is the pension. People want to work with NHS because they'll have a pension. Everyone's thinking about the future. When they stop working, at least there's a pension base that they could obviously be waiting for. So you get your pension with NHS. Again, you get your annual leave paid for. So you're getting paid whilst you're on annual leave. Again, the sick pay. If you're off sick, certain type of days, you're allowed, obviously, to get paid as well whilst you're off sick. Again, it's a more stable career with the NHS because every month you know how much you're getting paid, regardless of how many patients you've seen. Whether you've seen a full day list or you had quite a few gaps, it doesn't really affect your pay. You still get paid the same because you are an employee. You've been employed under the NHS contract. So your pay remains the same regardless of any patients you see. So if you're someone who is into budgeting, you want to budget, you want to know how much you get paid, you don't want to be surprised with maybe less money by, £400 less, £1,000, £1,000 less that month because you've seen less patients. If you're worrying about how to budget, then working under a set monthly pay as with the NHS can be beneficial for you because you know exactly how much you get paid every month and you've made your budget. So you know exactly how much you're getting paid. Nothing will surprise you on that month. So that's the advantage of working under the NHS. Again, maternity leave and paternity leave, you can get your leave and things like that. Whilst working for the private sector, sometimes it's difficult to get all these other benefits. Now, let's touch on the disadvantages. What would be the disadvantages of working under the NHS? So, mostly I would say it's less pay. Unfortunately, it's a significant amount of pay, less pay with the NHS compared to a private sector. If someone is making, for example, if someone is making £90 an hour, £100 an hour on the private sector, this is a hourly rate that the NHS cannot match for a dental hygienist. Even someone getting paid £40 an hour, they're getting paid £50 an hour. The pay is significantly lower with the NHS. There's less money that you're paid under the NHS. Again, with the NHS, it's not as flexible, like we talked about with private sector. It's more flexible. Sometimes you get to pick which days you can discuss with your contractors, which days you want to come in. There's a bit of negotiation going on. With the NHS, is mostly these are the days you need to work. This is the timing you need to be working, and you've got to do that. Whilst privately, with the family-run practice, even the bigger dental practice, the corporate, you do get to discuss the days that are convenient to you to come into work. You can discuss your hours. Again, you can discuss how your diary sort of looks. If you need a few breaks in between, you can speak to your contractors, your practice manager. As for some days, you've got a little bit of say-so in your diary and how your day goes compared to the NHS. The pay increases, NHS pay scales is less flexible. So these are the disadvantages. Ideally, you want to make sure that when you're working with the NHS, again, the potential is there for the pensions. The potential is there for sick pay. The potential is there for stability more with the NHS compared to the private sector. So this is something that you need to be aware of. All right, so let's go on to, we've discussed the private practice pay. So I'm so happy so far. If you join me or you're watching a replay, please comment in the comment section. If there's anything that I leave out and you want me to answer, please type your question and I'll be able to answer your questions later on. But definitely leave me some questions. If I miss anything or if you don't understand anything, please let me know. So now we're going to do the private sector. So like we said, we've discussed the pay for the private sector. What are the advantages of working for the private sector? The good thing with working privately, I would say with the private sector, like we said, is the pay. So the pay is higher compared to what you would get with the NHS. So you're getting more pay compared to the NHS. It's more flexible. You get a say-so on how you want the diary to run. You can change a few things, even though you can't change the policy, you can have a say-so on how you work individually, which is really helpful. You get to choose your working days, which days you want to work, and you get a good rapport with your patients. I find with the NHS, with the private sector, you've got a good rapport. Patients come in, they're happy to come and see you. And usually, if you've been there for a while, they get used to seeing you and you develop this relationship with your patients, which you can't get anywhere else. Sometimes when you work under the NHS or contracted, people come in just because maybe they want to come in. Whilst with the private sector, people definitely want to keep up their 3 monthly, 6 monthly reviews because they're paying the money. They're paying a lot of money to come in. So they're very motivated to come and have that treatment. And you develop a good rapport with them. So that's what I find under private sector. The disadvantages of the private sector, like we discussed with NHS, you don't have, most of them don't offer a pension scheme like the NHS. Individually, you have to set up your own pension scheme, with a private company or whoever has advised you to set up your pension scheme with. But usually the role doesn't come with benefit of pensions. It doesn't come with the benefit of sick pay. No sick pay, again, no holiday pay. The money that you get paid, that's it. And the other thing I didn't touch on is the tax, your income tax. If you're working on the private sector, most of the times you're working as a self-employed hygienist and independent hygienist. So you've got to set up your own income tax at the end of the year. So you have to go in, find an accountant, and they will do your tax returns. Whilst if you work for the NHS, when you get paid, that money that you're getting paid, the tax has already been deducted. So tax has been deducted, nothing for you to worry about. Whilst as opposed to the NHS, at the private sector, you have to actually file your own tax. So you've got to keep on top of things, making sure you've got all your taxes, income tax, obviously sorted. The most important thing, obviously, paying your tax is a way of proving that you work. Because if you want to get a mortgage, things like that, they'll ask you for your tax return, at least 3 years worth of tax return. So you need to make sure that every year you're filing. But these are the things you need to do for yourself. Once if you're working as an employer, then everything's done for you. By the time you get paid, your national insurance has been deducted, your tax has been deducted. So it's less things for you to think about. The other big thing, what we talked about is regardless with the NHS, regardless of whether you see patients or not, you still get paid. That's your monthly pay. You're employed by the NHS under the NHS contract. If you're working privately in a private practice, if a patient cancels, if you don't see patients, most of the times you don't get paid. You get paid once you see a patient. So patient cancellations will affect your pay at the end of the month. If your diary is not booked, that will affect your pay at the end of the month. So it's very difficult to do a budget with a pay that you don't know exactly how much you're going to get paid. Although it's a lot more, sometimes you might find you're getting half of that amount because you've had loads of, say, for example, in December and summer holidays, those are the times that sometimes your pay will be less because December people are away, they're on holiday. About 2 weeks leading up to Christmas, 2 weeks after Christmas, up until January, it's very quiet. Dental practices, as in my experience, you don't see a lot of patients because obviously Christmas is coming up, people are on break, there's less patients, so your pay will be less usually in December. Say sometimes in September as well, sort of summer holidays, August, September. Sometimes your pay is less because people are away, people are having fun, people are on holiday, people are not coming into the dental practice, they're away. So times like that, again, your pay might be less. So that's something to be aware of, that these months I might get less pay, but the months that you're making a lot, it's good to save that money. You're saving money away, so you don't really feel it in the months that is quieter. But that's something to be aware of, that in times where there is obviously there's less patients, you are not going to make as much as you'd want. All right. So I hope you're enjoying my live. Like I said, this is my first live. I want to trial out doing lives, because obviously I want to be able to communicate with my subscribers a bit more. I want to be more accessible. I want to be able to answer questions, Q&As. If people join, whether you're joining now or you're joining me later on, please leave me any questions or suggestions, things like that. I want to be able to know that the videos that I'm making are resonating with you, or what would you like to see? What videos are you looking for? Things like that. So if you can, please, that would be so helpful. Leave your comments and I always come back and look at your comments. And as well, please subscribe, like my videos, because that again lets me know that I'm on the right track And most importantly, it pushes the videos to people who are looking for this kind of information. And I believe there's quite a lot, because sometimes I get messages on my Instagram, or I get a message here asking me how can I become a hygienist? What do I need to do? What interviews or questions do they ask? So I believe that there's people out there, but it's just difficult to find the information and to find the right information. And this information is coming from me. I'm a dental hygienist. I'm actually a practicing dental hygienist. So I'm actually working at the moment, and I've been working for a long time, like I say, since 2008. So you're getting the information from someone who has been working and is working. I've been a dental nurse. I was actually a dental nurse first. So I qualified 2002 as a dental nurse. Then I did my dental hygiene training in 2006. And then in 2013, I did my dental therapy training. And I'm still practicing. So definitely, I feel I have the right, I'm working, I'm practicing. So I can give you hands on answers if you've got questions and things like that. Please do ask me. If I can, I'll answer you. If I don't know the answers, I will obviously signpost you to the right direction, or I'll ask and then I'll come back with the right answers for you. All right, so let's get back to our live. Like I said, please let me know when you watch the replay where you're watching me from. Like I said, I'm in England, in the south of England. I'm in Hampshire. So please message, let me know where you're watching from. Okay. So we've done private hygienists, NHS hygienists, how much dental hygienists can get paid, and what will the difference pay be in depending on how many days you're working, how long you're working for the day. Is it to 9 to 5 or just 9 to 1? All those sort of things will make a difference. So now we're going to talk about the difference between employed and unemployed. Sorry, employed and self-employed and employed. So let's have a little look. So we've done the NHS. So as dental hygienists, you can either be employed or unemployed. Sorry, I was a little bit distracted there. Let me start again. You can be employed or self-employed. When you're self-employed hygienist, you're more independent. It means you will make a contract with the practice you're working with. So you're employed, contract is different. Employed, you're working as an employee with a practice or the NHS. You are an employee for that practice, you sign a contract. So whether it's through NHS or a private practice, you're still employed. You come under their book as their employee. When you're self-employed, you're not an employee, you're an independent dental hygienist. You're working for that practice as an independent hygienist. You will form a contract as a self-employed hygienist. So you're not their employee. You are independent. You come in as a partner. So that's why you're more flexible into how the day you can get to pick which days you want to work, how many days a week, things like that, because you are a contracted independent hygienist. Whilst if you come in as employed, you have to go by the rules of that practice, that hospital, wherever that is, you have to go by their rules because you are part of their employee. You work under their policy. You don't have much to say to change the days that you want to work or the hours. You just have to follow in line what with the practice has already for you because you're one of their employees. So that's the main difference between employed and self-employed. So for me personally, I've always worked, since I qualified, the first couple years, I worked as an employee. After that, I then started working as a self-employed dental hygienist. And since then, I never looked back. I love working independently as a self-employed dental hygienist because I can get to reduce my days. If I want to work 3 days a week, I can ask to reduce my days. If I feel like, okay, Now it's actually busy. I can go and find another job, take on another day, make 4 days. But like I said, now I work in a practice where I'm working 4 days a week, and that's fine. It's working well for me. But it's up to you as a self-employed dental hygienist. You can work on you can work flexibly with your hours. Again, if you say I want to work up until 4 o'clock, you can have a discussion with your practice manager. If you're able to do that, you'll come into an agreement together. So it's less more like you're dictated on. You're almost as part of the team, as a contractor, as an independent person. You get to set your rules as well of how you want it to work. So you can be self-employed, working on an hourly rate where you get paid on an hour, or you can get paid a daily rate, say £250 a day, or you can get paid again if you're employed, an employee, you're paid the same rate per month. So that's the difference, if that makes sense. You can get paid an hourly rate, and when you're working an hourly rate, if your patient cancels within that hour, you still get paid that hourly rate because that's your rate. You're paid per hour. If you're paid by a daily rate, it doesn't matter if your patient's cancelled on that day because you're paid for the whole day. That's your daily rate. You can also get paid on a commission basis per patient. So depending on how many patients you see. If you see a patient today, you've seen one patient, you get paid the amount for that patient, a percentage of that pay. If you see 4 patients, you're going to get paid per patient of those 4 patients. Now, if you had a booked slot and your patient failed, they didn't come, and you didn't see a patient because of cancellations, you are not going to get paid, because you only get paid on a commission basis depending on who you've seen. So if the patient hasn't come for the appointment, if the patient has cancelled the appointment on that day, it means you don't get to see a patient, you don't get paid. So this is called the commission paid basis, percentage basis per patient. Now that works really well if you're working in a practice that is really busy, it's fully booked, there's no really chance for patients to cancel. Patients always turn up. There's no patients who are failing their appointments. It works really well that way, because in that sense, it doesn't matter. Your patients are always going to turn up, and you're going to get paid per commission, per percentage of the patients you've seen for the day. And I find that that works really well as well. Because usually the percentage is set quite at a higher rate than an hourly rate. As in my own opinion, I found that you get paid more as dental hygienist on a percentage basis, because sometimes you can get paid 45% of your day, of your patient's treatment. You can get paid maybe 50% of the day's takings per patient price. So sometimes it works out well, because if the practice raises the payment of your hygiene fee, that means your pay is going to get higher as well. You're going to get more pay. Say if the patient's treatment for hygiene was, let's say, £60, or let's say it was £70 per patient. Every 30 minutes, patients pay £70. And then they raise that treatment price to, say, it's been raised to £80. So that means your pay would be more as well, because if you're getting paid 50% of £60, now you're going to get 50% of £70. So again, that means your pay would be higher. So your pay increment would depend on whether the price for the treatment has gone up as well. So percentage pay, I find it works out really well. There's always cons and pros. So you've got to weigh everything out, because if it's a practice where patients always cancelling, then it's definitely going to affect your pay. So you've got to really, really look at all of these things and make a decision depending on what works for you. All right. So how is it going? All right. So we've discussed the self-employed, the hourly rate. I'm just looking on my notes, make sure I don't miss anything today. Yeah, make sure we don't miss anything. And like I said, please, when you watch my live later on, please let me know what I missed. And again, let me know what you would maybe like me to cover. But I'm thinking of doing these lives more often. So definitely type and let me know if you want to watch these lives again, or if I just carry on with my long form videos. Please let me know. Um, so for me, finally, for me, being a dental hygienist has been a very rewarding career. If you're thinking of being a dental hygienist and you're not sure, should I not? I would say definitely go for it. As for me personally, I've enjoyed being a dental hygienist and dental therapist. It's a very rewarding career. I love what I do. I'm so passionate about what I do. It's a preventative, obviously, career as a dental hygienist, and with therapy, it's a restorative treatment because you do provide treatment, fillings, and things like that, and you get the rapport with your patients. And when you do treatment and your patients are coming back, everything has improved. It's very satisfying as a dental hygienist. You tend to see the results right there. You don't have to do any reports. You don't have to do all this research to see if things are working. Excuse me. You see your patients as they turn up. You can see now they're flossing, their gums are healthier, they don't have any more new fillings, they don't have decay. So it's very rewarding. It's very, very fulfilling as a career for me. And again, the pay is not bad. The pay is really good. I should say the pay is good, and the pay is dependent on how much you put in. So it depends on you. If you're someone who wants to work 5 days a week, you're able to, and you want to work on a Saturday, on the weekend as well, and you want to work long hours. I know hygienists who've worked up until 8 p.m. I don't know how they do it, but they're able to do it. So it all depends on you. That's why I love this field. It's very flexible. And again, career progression is amazing. Like I said, I studied as a dental nurse. Who knew I would be progressing to be a dental therapist? When I was a dental nurse, I loved being a dental nurse. I loved every bit of it. Um, but one day I worked with a dental hygienist and I was like, I love that. That's what I really want to do. I want to do that independently, working with patients. So I loved that. So I was like, definitely, I want to go back to university. I want to be a dental hygienist. And I never regretted it. So dental hygiene is a very rewarding career. If you're thinking about it and you don't know, go for it. And again, what I would say about the pay, if you're already a dental hygienist and maybe you're on a pay where you're thinking, I don't earn £80 an hour, I don't earn £70 an hour, even £30 an hour, I've never earned £30 an hour, then honestly, if you're a dental hygienist, it's time to have a little meeting, ask your boss, ask whoever you work with. Nicely make it formal, not just meeting in the hallway like, oh, I want to discuss my pay. You don't pay me enough. No, make it formal. You know, be polite, bring your points across, ask them for a meeting. Is it okay if we have a meeting on so and so a day, at so and so a time? Is it okay if we sit down to discuss my pay, or briefly make it nice and, have a meeting with them? And then when you go for the meeting, don't just ask for, oh, I need a pay rise. Show them what you're bringing to the practice. If you've been working with them for the past 3 years, for the past 5 years, and you've got a very loyal patient base, your patients always turn up. Patients are improving oral hygiene. They're speaking, nicely about you, how you've helped them with the oral hygiene, the oral health, or they couldn't do without you. These are the things to say to them. Look, I've been working here for the past 5 years. When I came in, if we only had so patients. Now we're fully booked. Patients are happy to come and see me. I've got a loyal base of patients. Oral hygiene has really improved. Point out everything that you're doing, and then say to them, for the past 5 years, I've been on this pay. And really, I've compared the pay grades within this area, and the average pay for this area, say, is £32 an hour, and I'm getting paid £25 an hour. I can see I'm actually below the market. And I just wanted to discuss with you for the value that I bring for this practice. I feel I should also be, at least I should be on the average. This is not even above average for our area. Our area's average rate for a dental hygienist is this. And I feel that I could also be getting earning this pay because of the value I bring to the practice. So make it formal, the way that you obviously talk to your boss or your contractors, so you can actually get the pay that you deserve. And you know what value you bring into the practice, you know what you deserve to get paid. If you get to the point where they don't want a badge, they still want to keep you at that pay, then sometimes moving from that practice again can be a good thing, because when you move, you're bringing with you all that experience to a new role. So you're more likely to get what you're asking for. But first, I would definitely speak to whoever I'm working for. If I'm not making the pay I feel, the best thing to do is research what pay rate or average rate is within your area. Do that and then ask around different hygienists within the area, see how much they're getting paid, do an average, and then come in, ask for that meeting and see how it goes. But yeah, if they're not budging and you've tried and everything, maybe it might be time to move on, because you could make more somewhere else. Not exceedingly more, but what you're worth. Definitely what you're worth, because we bring a lot in dental practices. The fee that is paid into the practice from a hygienist, from a dental therapist, is quite a huge contribution that we put in. So definitely you want to get paid what you're worth as well. So that's definitely what I think. Let's see if we don't miss anything. Just taking my notes. Make sure we've got everything on here. Like I said, please send me any messages, any questions that you may have. It would be nice to do a Q&A on my live, but I just came on live. I didn't tell anyone. It's my first live ever. So there's no one showing up to ask me any questions. So when you do the replay, please ask your questions and I'll be able to answer your questions for you. But if we touch on questions, I did write down a few questions. So maybe let's do that. So if we do some questions, so these questions are questions that people usually comment on. They usually ask or they comment on. So I'm going to try and maybe touch on a few questions. So the first question is, how much did you earn in your first year as a dental hygienist? Okay, that's interesting. So, like I said, in my first year as a dental hygienist, I worked in the public sector. I didn't work privately. So, I was literally out of university, out of school. These were my first patients, of my own patients. So, it was quite a nice role to ease me into dental hygiene. There wasn't a lot of pressure, there was loads of gaps. As with the public sector, it's not about the monies really. It's really about seeing the patient. And patients under the NHS, they get more time, I find. And what sometimes filled appointments, patients didn't come up, so it gave me enough time to prepare for my next patient. And my pay wasn't that much. My annual salary was about 30,000, if I'm not mistaken. In 2008, I think it was about 30,000 or 32,000 pound per year. So that was my first role as a dental hygienist. My first 2 years as a dental hygienist, I was about 30 to 32,000 pound a year. Now, my second question was, would you choose NHS or private practice if you had the choice today? So if I had the choice today, would I choose to work under the private sector or the NHS? So, like I said, I'm working already under the private sector. So, I personally love working under the private sector. I wouldn't choose working under the NHS, and it's not about the money. Yes, there's less pay, but it's definitely about the flexibility. It's about the flexibility. And that's the reason why I left the public sector when I newly qualified and went into the private sector, because I'd just had my son. I'd just become a new mom. And after maternity leave, they wanted me to go back to work full time, 5 days a week, 8 to 5. And, it was very difficult. I didn't want to do that. I didn't want to come off from maternity leave and put my son with the nursery all day long, every day, Monday to Friday. I wasn't going to do that. So, hence, it wasn't flexible enough for me. That's the reason why I left. Excuse me. So that's the main reason I left. I left because it wasn't flexible enough as a mom, as a new mom coming from maternity leave. So I decided no, I couldn't be able to do it. And I left. I joined the private sector. And guess what? It was so liberating. When I joined the private sector, at that time, I only wanted to do 1 day, because remember, I was coming from maternity leave. I was trying to ease myself in and let my baby get used. It wasn't even a baby. My son was a year, 6 months old, but I'd always been home with him. So I wanted to ease coming back to work. So I found a job that only needed 1 day. It was only 1 day on Fridays. So that worked well for me at that point, because I'd have my son 4 days and then ease through, take him to nursery only for 1 day, the Fridays. So that worked really well. So, yes, if I were to choose again, I would choose the private sector because of flexibility. Question number 3. What's a fairly hourly rate for a dental hygienist in 2026? That's a good one. That's a good one. What is a fair hourly rate for a dental hygienist in 2026? Okay, now I think that depends on how much the practice is charging for each treatment for dental hygiene. So for each 30-minute appointment for a dental hygiene, it depends what the practice is charging. For example, if a practice is charging, say, £90 an hour, sorry, £90 for 30 minutes appointment, which means in 1 hour, that practice is charging £180 for two 30-minute hygiene slots. It's £180. So if the practice is making £180 an hour, and then your hourly rate, I would really think a fair amount would be around 45, £50 and more. Yeah, I think at least £45 an hour, if that's what they're being charged. To be giving you less than that, and also depends with the experience. To be getting £20 an hour when the practice is getting £180 an hour, I don't think it's a fair hourly rate. So I would say at least a minimum of £45 an hour. But if the practice is charging £60 an hour for hygiene treatment, then obviously I wouldn't say £45 per hour is a fair hourly rate. So it would be lower depending on how much they're charging for that treatment for the hygienist, if you see what I mean. Now, question number 4. Are you employed or self-employed? Like I said before, I am self-employed. I'm an independent, self-employed, very experienced dental hygienist. I've been a hygienist since 2008. So I love working as an independent, self-employed dental hygienist for private, corporate, private family practices. And number 5, what's your biggest challenge as a dental hygienist? What's my biggest challenge as a dental hygienist? So, what's my biggest challenge? Actually, my biggest challenge would be something that there's quite a lot of rapport. I think when I work with my patients, there's a lot of banter, a lot of rapport, and a lot of patients I've seen them for a long time. And when they come and see me, they want to have a chat. They want to have a chat. They want to tell me everything. But I only have so much time to provide them the treatment, to give them the treatment and get ready for the next patient because I'm fully booked. Every 30 minutes, 45, I've got a patient coming in. But my patients, most of them want to rapport because, again, I love, chatting with my patients, finding out how they are, make them feel at ease. So they want to tell me everything. So that's a challenge that I have to channel it into like my 30 minutes, make sure I control the conversation so we can start the treatment. So I think that's a challenge for me, definitely, because patients start feeling like, they know you, they feel comfortable with you, they want to tell you everything. But at the end of the day, we're also providing treatment and we want to get ready for the next patient and we want to provide our treatment professionally. So I think that's a challenge. Number six. Number six is, do you think dental hygienists are paid enough? Yes, yes, yes. I think yes. I think in the private sector, yes. I know there's jobs, I've heard of hygienists saying, oh, the pays you're quoting, I don't get paid that much. I don't, but I think you also need to look for those jobs, especially if you've been in a role where they're paying you a lower rate and you just stay there and you don't ask for a pay rise, nothing's going to change. So you also have to be proactive, but definitely there's jobs out there. So I feel like, yes, we're paid enough, but as hygienists, we also have to be proactive. If you feel if you're not getting paid what you're worth, then you could definitely look for somewhere else where they're going to pay you because the jobs are there. They're definitely there. All right. So, what's number seven? Would you rather have job security or a higher income, which means working under the NHS or working under private sector? So, would you rather have job security or a higher income? I think it depends where you are in life. Because if you're in the private sector, you're getting a good pay, a higher income, then you're able to take that amount of money away and put into a private pension scheme. You're able to save money, and when you're sick, you can use that money on the days that you're off sick. You can use that money to go on holiday. So basically, I feel like both are the same because if you're someone who's organized and you have a higher income, you can put money away for the things that you're missing, the benefits that you're missing as compared to NHS. You can put money for the pension. You can put money away that when you're off sick, you've got some money saved away that you can use. Again, you can have income protection, pay into an insurance when you're not well. So I think it just depends where you are in your life, but with good planning, both are the same. With good planning, I think you can achieve with both of them. Number eight, if you are a student, what salary are you hoping to earn after qualifying? So if you're a student, what salary are you hoping to earn when you just qualify? So if you are a say if you're going to work under the NHS and you're newly qualified, expect to earn anything from 28 or 30,000 per annum as your starting salary, or maybe all the way 32, 35 max as a newly qualified NHS employed dental hygienist. If you're privately employed dental hygienist, expect to earn anything newly qualified straight from university from say maybe 38 grand, 38,000, 40,000 pound a year, maybe starting salary, something like that. Number nine, what's number nine? Which part of the UK do you work? Like I said, I work in the south of England. That's where I live. I've worked in Surrey. I've worked in Hampshire. I've worked in the Midlands as well, but I noticed the pay is more further south. And I've worked in London. London had the highest pay when I worked in London, but I work in the south of England, and again, the pay is a little bit more down south, and especially in London. My last question, number 10. What's one piece of career advice you would give a newly qualified dental hygienist? Okay. What's one piece of career advice you'd give a newly qualified dental hygienist? Okay. So the advice I'd give for a newly qualified hygienist, I would say always put, if you're newly qualified, I would value experience anytime over income. Value experience, that's what you need. If you get the experience, the right attitude, you are unstoppable. You are unstoppable. You can leave that job and find any job, everyone will want to work with you. Once you get your experience, that's it. That's all you need. As long as you find that first job and give it your all, learn as much as you can, go for your CPD, go for courses, give everything, get your rapport with patients, get comfortable with patients asking you questions and answering them. Showing them that you're an expert, you know what you're talking about. Start learning all of that, how to conversate with your patients, get comfortable, make it seem natural. Even though you're working in their mouths, it's going to be painful, you're giving injections, things like that. Make it look natural and learn to be natural with your patients. Gain all the experience, all the treatment that you can do. That's what you need. Even if you're looking for a job, there's no job openings, and one job comes up and it's not the pay that you're expecting. Weigh it up. If it's a good practice, everything else feels right, but it's only the income, and you're a newly qualified hygienist, I would say take the job. My advice would be take the job so you can get the experience. Work there for 6 months to a year, at least a year and so. Once you've done a year, at least you can put on your CV a year's experience. Then you can move, find another job, and demand the money that you're looking for. Because again, practices are not most of the times willing to pay a newly qualified hygienist a higher rate because they haven't tried. They don't know how you work, how your work is like. They don't know how their patients are going to respond to you. So in the beginning, they're not very willing. But how if they see how you work, how patients are happy with you, they're loyal, they're coming back, they're more likely to increase that pay. So I would say just take the job, get your experience. You never know. 6 months down the line, 3 months down the line, they could increase your pay once they know how you work. So yeah, that's my piece of advice. So thank you very much. I think I've talked a lot. Keep drinking water. I think I've done a lot of talking. I hope this has been of value. Like I said, it's my first live. I might have been distracted in some areas. Hopefully not. I hope you're able to take away what's important to you, leave what's not important to you. I hope you take all the positive bits. I hope this live was beneficial and is what you were looking for. If you've got any questions, please pop them in the chat. I will definitely come back and look at the chat and get back to you. If you want a replay, again, thanks for watching in advance. But definitely, please like, comment, most importantly, subscribe, because that shows me obviously that I'm on the right track. I'm giving you the right content. Again, it's very good for algorithms, for all the other, obviously, hygienists out there that want to see this information. And please give me suggestions. If there's any topics you want me to touch on, please do let me know what you want to watch. And thank you. Thank you very much. Hopefully this is the beginnings of my lives, and hopefully we can do another live in the next coming weeks. Thanks for watching. Bye.